commencing the PCA setup. Remembering that a PCA is generally made from an S8 narcotic, so it does require 2 RNs to be there at all times to see the S8. Hand hygiene. Okay. So again, I'm going to go through the components of the legal order and ensure that this is a legal order. So first I'm going to look at the IV fluid order, which is for sodium chloride 1000 mils, which I'm going to gather from my fluid room. And I have an order for a PCA which states that we're going to be using fentanyl 1000 micrograms using a diluent of sodium chloride 0.9% to a total of 100 mils. So that means that I have to remove the volume that I intend on using in the bag. And that's going to end up giving me a concentration of 10 micrograms per mil. So IV fentanyl 1000 mics. Okay, so now that I'm here, I'm going to start gathering all of my equipment, and I've checked that it's a legal order. I have my patient's name, their MRN, their date of birth. I've checked their allergies, the same for my PCA order, identification, no allergies. I have a legal order, the medication's written in the generic, a route is IV, the amount or concentration is 1000 micrograms, the dose is 10 mics per mil, and we're going to be giving 2 mils each time they push the button. We need to review our 9 rights, so we're going to go through all of our 9 rights at this stage, and then we're going to collect our resources and review the AMH to look at what the medication is, potential side effects, so that we can inform the patient when we go back to gain consent. So now that we've checked that we've got a legal order, it's time to gather our equipment. I find it easiest to do this by keeping things orderly for myself, and I know that there's 4 stages, so I like to use 4 blue trays for this setup. Each of these trays corresponds to a different section of what I'm doing, but it also helps me make sure that I've collected all of my equipment correctly. The first thing I'm going to grab is 0.9% sodium chloride. And as I'm gathering each of these, this is when I'm performing my first check. So I'm looking that I have 0.9% sodium chloride. Each of these is for a flush and expires 0.8, 20, 25, and each is 10 mils. Each of these flushes is going to go into one blue tray. One is the flush for the IV cannula. As such, I require a 10 mil Luoloc syringe, and I'm going to check the expiry of that, which can be found on the flap here, and that expires in 2026. So that goes into the tray. This flush is actually to prime the sidearm on the PCA line. We're going to show you that in a second, but you do require a small flush. So for this to keep us straight in my head, I like to grab a 3 mil syringe because I only need about 0.5 of a mil. So again, this is a 3 mil Luoloc syringe, and again I'm checking the expiry on that, and that is 2027. 3 mil Luoloc, and again that's going into my blue tray. Both of these are drawn up using a red needle, so I require 2 red needles for this. So red needles are beveled, but they are not sharp, so we use these just for drawing up. So I'm going to check the expiry date on each of these, which is 2027 and 2027. I have 2 of them, and 1 is going to go in each of my 2 trays. And that's the first part done. The second 2 trays are for the fluid going in, meaning our S8 medication, and the fluid coming out, meaning the fluid from the bag that has to come out because we're adding a volume of fluid. For that I need 2 20 ml syringes. Again, Luoloc syringes because we use Luoloc to avoid sharps injuries. So I've got 2 20 ml Luoloc syringes, and again I'm going to check the expiry on the flaps, and again that's 2028 and 2028. So one of these, as I said, is for fluid coming out, so that's only going to be used for fluid coming out of the bag. So I only require a green needle because it has to be a sharp needle to pierce the bag to avoid the issue of microplastics. So again, I'm going to check the expiry date on this, and this expires in 2025, and I'm going to place my green needle in there, and that's all I require for that. This one is for drawing my S8 medication up as well as injecting it into the bag. So I'm going to need a red needle and a green needle. A red needle for drawing the medication up and a green needle for injecting the medication in. So again, I have a red needle, checking the expiry is 2027, and that's a blunt beveled needle, and a green sharp needle, checking the expiry is 2028, and that is going in for that section. At this point, I'm also going to grab my lines. I need 2 lines. First, I require a CAD administration set PCA line, and the CAD administration set has a picture on the front, and the one that we want has a little side port. We also need to grab a no port Agila line set. Again, remembering that we do not have any medications being administered with our PCA, so we cannot have any lines where medication could inadvertently be administered. So a no port set, it still has a spike, it still has a roller clamp, but there should be no other ports. At this time, looking at my order, I require sodium chloride 1000 mils to run with my PCA bag. So I'm going to gather a bag of sodium chloride, performing my first check at this stage. Sodium chloride 1000 mils, expires 2026, and my order is for sodium chloride 1000 mils to run at 50 mils per hour. So I'm happy that I've got the right thing. Again, that was performing my first check. My second thing that I need to grab is also an IV mini bag, 100 ml sodium chloride, because according to my PCA order, this medication is going to be using a diluent of sodium chloride, 100 ml. So I've grabbed sodium chloride, 100 ml, expires 2025. The last thing we need to gather is our S8 medication from the cupboard. So for this task, we actually need 2 RNs to proceed to the treatment room, unlock the DD cupboard and grab that fentanyl medication. Once you're ready to gather the S8 medication from the cupboard, you and your second RN will head to the cupboard space and you're going to gather the S8 book. The S8 book is also known as the DD book or the Drugs of Addiction book, and it should be sitting with the S8 medication either underneath or inside of the S8 cupboard. The first thing you're going to look at is the index page of the S8 medication book, which will show you all of the S8 medications available in your cupboard. When you head to the page for the S8 medications, you're going to first see that you need to put the date and the time in and the name of the patient. You're going to record the amount that you're going to take from the cupboard. So in this case, we're taking 2 ampules of fentanyl, so we will be removing 2. You then have to conduct a count of all of the fentanyls of your concentration remaining in the cupboard to ensure that the number that are remaining matches the number in the book. Okay, Marianne, so we're just going to sign out some. I've got the order for PCA for John Bryant, 2017-05, date of birth 13th, 3rd, 48, no allergies. The medical officer's written him up for IV fentanyl, 1000 mics to go in 100 mils of sodium chloride, concentration of 10 mics per mil.
Yes.
So just looking at the book, so I think our best option is probably our fentanyl 500 mic amps in 10 mils. It's the biggest concentration we've got. So that'll just be on page 74. I'm in page 74, okay. So just looking at the book here, we should have 20 in the cupboard. So I've just put the keys in here already and then unlock this. Valium, Endone, that's morphine, fentanyl, here we go. So we've got fentanyl, 500 mics in 10 mils, and that's 500 mics in 10 mils. And we had an order for 1000, so we're actually going to want 2 of these.
Yes.
So 500 mics in 10 mils, 500 mics in 10 mils, 26 and 26, both are fentanyl and fentanyl.
For a total of 1000.
1000, perfect. Okay, so we're taking 2, so that's going to leave us with 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, and 18 matches the order. Perfect. So that's 20 minus 2 is 18.
Correct.
Putting them back and keeping us with 2 fentanyls, 500 and 500. Expires 26. Okay. Just lock the cupboard. Okay, so just filling that out. We have the date is the 21st of the 11th, 23. It's 1100 hours. Our patient is John
Bryant.
Bryant. We're taking 2. We had 20. That'll leave us with 18. The name of the prescriber is Andrews.
Correct.
I'm Foster and sign there, and then I'll just get you to write your name and sign there. Perfect.
Thank
okay.
you.
Thank you, sister. Okay. And so we're ready now to take that back. I've got some bits and pieces all set up in the treatment room, but you'll need to come with me because this is an S8 medication, so you need to stay with me until we press start on the machine.
Indeed. Thank you.
Our DD medication, the 2 RNs will be together for this, and we are going to place the fentanyl into the fentanyl tray, remembering that we have to make sure that we keep that separate so that the fentanyl is always accounted for. The other things we're going to grab are a set of gloves, and we will also want some alcohol swabs for when we're swabbing our cannula. Now we're ready to start preparing everything. Making sure that you've got adequate space on your trolley to perform these tasks. I like to wear gloves to do this task. It helps me feel like I'm doing a clean task, but remembering that all of this is done through an aseptic non-touch technique as much as possible. So I like to go from side to side performing these tasks. So the first thing I'm going to do is collect my tray for my flush. Remembering that we can recap our needles, but we have to do it through fishing for the cap in the tray. As such, nothing can be in our tray so that we don't touch anything with that needle. So opening up our 10 ml syringe, opening up our red needle, screwing the red needle onto the 10 ml syringe, and at this stage we perform our second check because we're at the point of preparation. Sodium chloride 10 ml expires 2025, and this is sodium chloride to flush our cannula. Screwing the top off the ampule, we take the cap off our needle and place it in our blue tray, and then straight in, ensuring as we draw the fluid up, our needle is always below the water. We can't inject air into this ampule because it will ruin the surface tension and push the fluid out. So once we've got all 10 ml, we can fish for the cap by grabbing it with the tip of our needle, ensuring we don't touch anything, and we can recap without at any point touching. Once we've recapped, we can remove any air and ensure that we have the required 10 ml for our IV flush. That then goes into the tray with the ampule, because remembering our bedside check requires the ampules to check it with. Next, we're going to do our 3 ml priming solution. Again, nothing can be in our tray, and we have our second check of sodium chloride 0.9%, 10 ml, expires 2025. We open our 3 ml syringe. We open our red needle and luer lock it on. The top comes off the ampule, and again the cap can be placed into the tray without touching, and the needle goes straight in without the red part of it ever touching the ampule, because remember, the ampule is not sterile, it's been sitting out on the shelf the whole time. Once we've got close to 3 ml, and remember we only need about 0.5 of a ml, we can then get our air out of our syringe, and again placing them in together so that that's ready for our third check. Now we're ready to remove the fluid from our 100 ml sodium chloride bag. So again, sodium chloride 100 ml 2025, but this time I need to check this against the order which stated that I was reconstituting my fentanyl using sodium chloride 0.9% to a total volume of 100 mils. And that's for John Bryant, who has no allergies, and this is for the IV route with fentanyl, etc. So I'm doing all of my checks. So I've got my sodium chloride and I'm opening my bag. Just peels open. On the sodium chloride bag, you can see there's two ports. One is white and one is blue. The white port is for any injecting in or out of the bag. The blue port is only used to spike the bag. Nothing can go in or out of this blue port except for the spike for the IV line. So we are concentrating on the white spike. So we're going to place this, and you can see it's got these little caps here with arrows, so things can go in and out of the white, but they can only go out of the blue. So this is going to now sit on my tray, nice and flat, so that when I'm ready to pierce this bag, I don't risk needle stick. I'm going to grab my 20 ml Luolox syringe, open that, open my green needle and attach it. And again, as always, nothing else in my tray while I get ready to remove the cap. So I've loosened that, but it's not removed. I'm now going to snap the white cap off that had the arrow on it. So now I can see the injection port. This is previously protected by the cap. Now this is a risk of contamination. So we have to ensure that nothing touches this except the needle. So again, I'm going to place this flat on my tray, remove the cap from my green needle. So now that I'm ready to remove the fluid, I'm going to, after I've removed the cap, hold the white cuff. This is a hard plastic and it stops the risk of needle sticks. Not entirely, but it helps. I'm going to place the needle in straight, no angles, just straight in through the injection port. And once I enter just a little bit, there's a membrane that I have to push through. Once I've injected it, I then place the needle in and I remove 20 mils of fluid because I'm adding 20 mils in. This can take a little while because the green needle is not a huge bore, but I do need to be accurate with the removal of 20 mils. Just going to put that little bit of air in to the bag and then out, and I've got a neat 20 mils. This time I'm going to remove the green needle from the bag, recap it, remove the needle and place that straight into the sharps bin, and I dispose of this immediately so that I don't risk confusing my fentanyl and my fluid at the end. So that goes straight into the bin. So now that we have removed the 20 mils from the sodium chloride bag, we have 80 mils in here. As we said earlier when we were pulling the medication out of the cupboard, we know that our fentanyl, we have an order for 1,000 mics. Our ward stocks fentanyl 500 mics in 10 mils. That meant that we required 2 10 mils, which was 20 mils. So as we know, the fentanyl had to come out of the cupboard with 2 RNs. And as we said, our RN is still here with us while we're actually drawing this medication up. The RN will also accompany us to the bed space and be with us until we're ready to press start on the machine. So again, this is fentanyl, 500 mics in 10 mils expiring 2026. Fentanyl, 500 mics in 20 mils expiring 2026. So I'm now ready to draw this up using a 20 mil syringe and a red needle. Doesn't need to be sharp to draw this up. I'm going to create some space on my tray, so I'm going to move my fluid out of the way and have my bag sitting just there, so there's no risk that anything can touch the bottom of it. I'm going to grab my blue tray. My green needle I'll need in a minute to inject into the bag, but at the moment I need the red needle. I have my 20 ml Luolox syringe, which I'm going to open. And I'm going to open my red needle and Luolox that onto my syringe. I like to separate my two fentanyls, just makes it a little bit easier for me to open them and pull the medication out. So red cap off and into the tray, and the cap comes off. Just exactly the same way as we did with our normal saline, except this time we want to ensure that we get every drop of the medication out of the ampule. Again, we do this by ensuring that at no point does the needle go above the waterline and there is nothing at all left in our ampule once we've drawn that up. It's empty. So once we've done that, we recap our needle, remove the air, and get ready for our second ampule. Again, we must keep this ampule until the bedside check. Second cap off, and the red cap comes off our needle, and again straight in, keeping the needle under the water and drawing up the full 20 mils of our fentanyl till there's none left in our ampule. And again, red cap on, keeping the ampule, and we remove the air, at which time we have our neat 20 mils. Now I'm going to attach my green needle. So the red needle comes off, and again it's a sharps. It goes straight into the sharps bin, and our green needle goes on. Again, I'm going to need my tray in a moment to recap. Now that I've got this green needle on, I'm ready to inject into the bag. Using the same port, it's the white port again, remembering that anything in or out of the bag except for the spike goes via the white. So the needle cap comes off into the tray so we can recap. Again, holding the white cuff and going in straight. We inject through the membrane and we can inject our 20 mils into the bag. And this will bring us back to our very neat 100 mils, which was what was required of our PCA order, which said that it had to be 1,000 micrograms in 100 mils to get our final concentration of 10 mics per mil. So that goes in, and now we've got 100. Recap straight away, if we can get it. Again, the needle straight into the sharps bin. So now that we have injected that back in, we have our neat 100 mils again. The last thing we have to do is complete our label. So the fentanyl ampules, again, we've checked them both times, first when we were gathering it, second when we were preparing it. They go into our blue tray for our third and final check at the bedside. But we do need a blue label to go on our bag. Remembering that the blue label must come underneath the name of the fluid but above the batch number. So we must be able to see the batch number and the name of the fluid. So I'm going to gather a label from the treatment room. And we want a label that's for intravenous use. So at this point you can remove your gloves. I will choose to. Perform hand hygiene. Okay, and then you and your second RN are going to complete this label. Okay, so the first thing we need to complete is the patient's name, who is John Bryant, B-R-Y-A-N-T. We then need the patient's ID, which is 201705, and date of birth is the 13th of the 3rd, 48. We need the medication. As we know from the order, this was fentanyl. The next thing it wants is the amount in units. This is always the base unit. So for this, it's 1,000 micrograms, and it must have the units written, mcg. Divided by the volume. So remembering that we took 20 mils out to put 20 mils in. So the volume is 100 mils, which equals, if we've done it correctly, 10 micrograms per mil. Our diluent, as we know from our order, is sodium chloride. The date is the 21st of the 11th, 23, and the time is 1100 hours. Prepared by myself. And the second RN will then come and sign that, and remembering that the second RN has been with us the whole time to ensure that that's signed correctly. Perfect, thank you so much. All right, that label is now attached to the bag, as we said, underneath the name of the fluid, but above the batch number. So we peel the backing off and attach that under the fluid name, but above the batch number. Okay, so that's now ready to go. So now that we've prepared the bag, we're ready to start priming our PCA line. So I'm going to move this, so I've got a little bit more space that can go up with the bag of that. So now what I need to do is grab my CAD administration set, again checking that I've got the set with the sidearm, because this is where the IV line is going to come in. As we said, this sidearm is currently full of air. As soon as we attach the IV line to this and press start, if we don't prime it, we will push this air into the line and then into the patient, which we don't want to do. So I'm going to don some gloves after performing hand hygiene, and I'm going to open my administration set. These administration sets always come wrapped in their own flyer, so you'll find it inside of the flyer. And there are 3 clamps on this line. One will be found on the sidearm that we're about to prime. So we want to ensure that we push the slide clamp closed, like so. The second clamp can be found at the far end that attaches to the patient's cannula. So again, taking the slide clamp, we push it with our finger and slide it closed. The final clamp can usually be found in the big ball of line, and again it's a slide clamp, and we take this opportunity to slide it closed. So now all 3 clamps on this line should be in the closed position. We want to ensure that we've got control of our spike and our far end, but what we're concerned about right now is priming this sidearm. We need to prime the sidearm from where the blue cap is to where it connects to this Y joint just here. So it's literally from here to here, and there's even a little line on here so that you can see where to prime to. So we're going to gather our 3 mils of normal saline that we drew up, and again doing our final check that was sodium chloride, 10 mils, expired 2025. Removing the red needle and placing that into the sharps bin. We come back to our line and we remove the blue cap. That's just done by spinning and removing, making sure that nothing but our 3 mil syringe touches the white end. 3 mil syringe goes on, and now we want to unclamp our sidearm and prime just until we hit the Y, and then we reclamp. That's now primed the sidearm. I don't prime any more of this line because this line gets primed by the PCA machine once we load it. But what I will do here is take my spike and unspike the end, remove the blue cap from our PCA bag, and I'm going to spike straight in to my PCA bag, ensuring that I go in as far as I can, because this can be quite fiddly once we get to the PCA machine. I'm now ready to go to my patient's treatment space. Once you re-enter the bed space, remember to reintroduce yourself to the patient and remind them that you're there to complete a PCA setup. Again, you're not gaining consent at this time, you're still performing the setup. John Bryant, and his date of birth is the 13th of the 3rd, 1948. And do you know anything about allergies at all? No allergies, okay. And MRN is 201705.
Correct.
Okay, and so as we know, we have just made up our order for fentanyl, 1,000 micrograms. So that's 500 and 500 in 10 mils each, and we've put that into a bag of sodium chloride.
Okay, yes.
So we're ready to come to our PCA. So we're going to take our key and unlock the machine, and we can move the machine forward and hang the bag on the arm there, and then push that back. So I've pre-primed this with the 3 mils of saline that you saw me do in the treatment room. Firstly, we need to remove the blue protector from the cartridge. Once that's removed, it cannot be put back on. And now this is going into the machine. The little feet here at the end, so there's 2 little feet at one end, and they come up underneath the machine, and there's corresponding bars that they link over. So the feet come up from underneath and clip over the bars. This silver arm now lifts down and the cartridge clicks into place. We keep our thumb keeping pressure on there and push the arm up and then lock the side of the pump. And that's now locked in place, and that can't fall back out. Now I'm ready to turn this on. Okay, so it's asking me, do I want to start a new patient? Yes, I do. And then obviously program manually. So I'm going to hit select for that. And then our code for our machine is 921. Then accept. Now selecting the units, I always program this based on the units in the prescription, which is micrograms. So I'm going to use the down arrows to get to micrograms and select. It auto loads at 500 mics per mil, but we know we had 1,000 mics and 100 mils, which makes it 10 mics per mil. So I'm going down to 10 mics per mil, and then confirm. Okay, and then it says we're doing a 10 mics per mil program, so yes. Okay, and so now it's going to load the program, so we're going to review the pump settings. Review. Okay, so the first thing it wants to know is the continuous rate. So on there, that's what's continuously running in the background. So that's our background rate of 30. It's a bit odd because we don't often have a background rate, but
Correct.
Today we do. So we've got a continuous rate of 30. So I can just press and hold that to get it up to 30. And then confirm 30 mics for the continuous background infusion.
Correct.
And then confirm override the soft limit. Yes. Then we have our PCA dose. So we have a dose of 20 mics, the bolus dose. So that's each time the patient pushes the button, they're going to get a bolus of 20 mics or 2 mils. Confirm.
Correct.
Okay. And then a lockout. So because we don't want the patient to have too much, the doctor's prescribed a 5-minute lockout. So we'll go down to 5 minutes. 5 minutes, confirm.
Correct.
And then override that. And then lastly, the reservoir volume, which is the volume in our bag, was a neat 100 because we took 20 out to put 20 in. So that's going to become, whoa, wrong way. So press and hold again. And then 100 mils is our reservoir. Okay, and just confirming one more time, we have a continuous background of 30, we have a PCA dose of 20, we have a lockout of 5, and we have a reservoir of 100. Okay, so I'm going through, and you agree with that, sister?
Correct.
Accept, accept, and yes, we have fentanyl 1,000. And then next, prime the tubing. So at this point I need to unclamp my large clamp at the end and unclamp my clamp on my small end. But I leave the side arm clamped. So 2 on the main line unclamped, side arm clamped. So pressing prime, yes. Open the clamps, disconnect from the patient and press prime. And so now the machine is going to auto prime the line for us. And here it comes. And it usually takes somewhere between 3.8 to 3.9 mils to prime this line. So this is obviously different to what we've been doing with our IV pumps because our IVs, we've been manually priming the line. And here it comes. And then once it gets to the end in the cap, I'm going to wait for the fluid to hit into the cap. Here it comes. I'm going to press stop prime. Okay, and that took 4 mils. Continue priming, no, because we've primed that to there, but I am going to clamp it just at the end because I always do, it just makes me feel safer.
Safety.
I'm now going to lock the pump to make sure I don't forget to do that. Using the lock on the side there. And now it's ready to start once I'm ready. So I'm going to place that just there for the moment. I'm going to put on my gloves. John, can I just get you to confirm one more time your full name and your date of birth for me? This is John Bryant, the 13th of the 3rd, 48. Yep, that's perfect. MRN is 2017-05. And confirming that you don't have any allergies that you're aware of. You do not. Okay. So taking my Alco swab, coming to my cannula, swabbing that for 30 seconds. And I'll be leaving that to dry for a full 1 minute. I'm then going to remove the red needle from my flush. And this is my 3rd check that I've got sodium chloride 10 mils, expires 2025 for a flush.
Correct.
Okay. And coming to my cannula, luer locking on my syringe and flushing my cannula. John, this shouldn't hurt at all, but it might feel a little bit cold as it's going in. Is that feeling comfortable? It is? Okay, great. So it's just pushing in just slowly, slowly, but I'm very happy with how that's flushing. Removing that. I'm now going to connect my PCA line straight to my patient by removing the cap from the end, connecting it to the cannula, like so, and I'm ready to press start. Now, the pump is starting, and now it's running. Obviously, nothing's going to happen with this yet because the patient hasn't got the button, so they haven't pushed it. There is a small continuous infusion running, but it's very micro. And I'm going to unclamp this, and now I'm going to set up the IV line that runs with it. So for that, if you just want to flick to the IV therapy, sodium chloride, 1,000 mils, expires 2026.
Yes.
And this is my 3rd check of this at this point. So I've got my sodium chloride, hanging it on my IV line. Oh, got my glove. Okay, so again, it has the 2 ports, the in and the out, but we are only spiking into the big bag. So that's our blue cap off. For our IV line, we're just going to open the line, remove it from the bag, keep control of both ends, and close the roller clamp. All right, undo the spaghetti, uncap the spike from the end, straight into the blue port of the bag, and I'm going to fill this up until it's about the midway point where there's a line on the drip chamber. And then going to open my roller clamp to let that prime, and I want to do that slowly to make sure I don't prime this full of air. And then once it's hit the roller clamp, I need to just let it open a little bit more. Okay. And then it's coming through to the end here. And then once it hits the end, I just close the roller clamp. I'm going to take the cartridge here, and I'm going to place it into the pump. The green goes to the green end and the blue to the blue end. And I'm just going to clip that in place like so. Push the front up and click it down. We're having adult general. And now it's going to do the occlusion test, and we should see 5 smiley faces. It's telling me to open my line, so I'm going to open my roller clamp. And I'm going to scroll on my menu to drug X, which is our mils per hour protocol, and press OK. Now our prescription was for 1,000 mils to run at 50 mils per hour. So up to 1,000 mils, because that's our volume to be infused. Okay. I could enter in the number of hours, or I can press OK again and it will let me enter the flow rate, which is 50 mils per hour.
Correct.
50. Press and hold. There we go. So 50 mils per hour, 1,000 volume to be infused. Okay. And then that's ready to start. So John, just to give you a bit of information about what we're doing here. So I've set this up. This is a PCA. It's also known as patient-controlled analgesia. And the idea of this is that there's a medication in here, it's an S8 medication known as fentanyl. And so fentanyl is a really strong pain medication that we can give via the cannula in your arm here. We give you a button and you just push the button each time you feel that you need to have some pain relief administered. We make sure that we set the pump up in such a way that you can't overdose, so we have what's known as a lockout window. So once you've pushed the button, nothing will be administered again for another 5 minutes. And that makes sure that we're, ensuring that we're not giving you too much of this medication. So essentially, as we said, you've had this operation done. You will start to have pain potentially coming on after those blocks wear off. And so this pain PCA is here so that you can control your pain relief from here on out. The risks of this medication, fentanyl, is it is a respiratory depressant. So by that we mean that it can cause your respiratory rate to drop. We make sure that we monitor you very closely, and we also set up the machine in such a way that you can't have too much of the medication. We also make sure we're checking back very regularly to see how much you're using, and we will set you up with a set of nasal prongs, so a little bit of oxygen to go via your nose. Are you happy for me to continue to do that procedure? Are you happy for me to attach that and start that? You are? Okay, thank you so much. So now I'm going to remove the 3 mil prime that has been protecting the end of that sidearm. Take my Alco swab and swab the end for 30 seconds. Leave it to dry for 1 minute. Remove the blue cap from the end of the IV line, straight into the sidearm end. Make sure it's in place. I can now unclamp that, and that's also ready to start. So just checking one final time, sodium chloride 1,000 mils expires 2026. Sodium chloride 1,000 mils to run at 50 mils per hour. Perfect.
Correct.
And then start. Okay, so they're both started now. I'm just going to get a bit of tape in a second when I come back and tape that in. John, does that all feel okay for the moment? It does? Okay. So we're going to leave that run just for a second. I'm going to complete our paperwork and then I'm going to come back and check on you in about 10 to 15 minutes. In the meantime, I have here for you this little button. This button is how you control the PCA. So each time you press this little blue button, the PCA will deliver a volume of medication, assuming that it's not within a 5-minute window of when you previously had it. So if it's within that 5-minute window, even though you push the button, the medication won't go in. But if it's outside of that, you push this, then it's going to give you a little volume of the medication, which is going to help with your pain management. So I'm going to hand you that now. Patient's got that. And if you have any questions in the meantime, just buzz the buzzer and we'll come running. I'm just going to sign this now, so I'm going to put the date in here, the 21st of the 11th, 23. As we said, it's 1100 hours. We aren't going to be here when it finishes because it's going to be running for ages at 50 mils an hour. So whoever is here when it finishes fills that out. I'm going to print my name here, Foster, and sign. And then I'm just going to get you to also print and sign your name just here, please. Thank you. So we're going to follow our local hospital policy. We're going to come back and we're going to complete our observations, which includes our pain score, a sedation score, respiratory rate and oxygen levels, obviously because we have to do the amount of oxygen that we're administering because it's a drug, so it has to be prescribed. We need to include the PCA dose, the background rate that's been running there, and then we need the initial if we're going to change the program, but we're not planning on doing that. And then we also need to go through the program and determine how many attempts, so how many times the patient has pushed the button, and then how many times it's delivered, so attempts versus successful. And then we'll just initial there to say that we check the program, but we don't need to do that now until we come back for our first set of observations. The next thing I'm going to do is start the patient on a fluid balance chart. So the date is the 21st of the 11th, 2023. Open this up. So again, putting the date at the top. So we need to come to the 11 a.m. line on our fluid balance chart and we're going to put IVT. So we've commenced IV therapy and that was running at 50 mils an hour of normal saline. And then our line B, it can be PCA. And at the moment, we only know that the patient's getting a 3 mil background dose. So we'll just put a 3 in there. But if we came around and we saw that the patient had pushed the button a couple of times, it's each time they push the button times 2, because they're getting 2 mils each time. And then line C is the flush, which is 10 mils. And then we add that up, which comes to 63 mils for the hour. And we don't know if they've had any output yet. We haven't seen any urination. And then the last thing I'm going to do is complete a progress note to say that I've started that. So today's date, 21st of the 11th, 23, and the time is 1100. Start with nursing. And I'm going to write PCA commenced as charted, program per order, IV therapy commenced at 50 mils per hour, patient educated, reuse, patient comfortable, at time of report. My name printed, and my designation as RN. And that's it. We're complete.